Hello people, in this video let us look at this terminology Rhinitis Sicca. Sicca is actually dry, right? Rhino, nose. Hitis, inflammation. So basically nose, something affected here, inflammation, dry nose, okay? So basically it comes under a type of chronic rhinitis. Over a long period of time this happens, right? Dryness. So basically if you remember in chronic rhinitis we have seen that non-specific inflammation, chronic conditions of the nose. In that we have so many types, atrophic rhinitis, then you have, let's look at it from beginning. Wait, chronic simple rhinitis, hypertrophic rhinitis, atrophic rhinitis, Rhinitis Sicca, Rhinitis caseosa. In this video we want to look at Rhinitis Sicca, Sicca dry. Okay, so Rhinitis Sicca is what? It is a type of chronic rhinitis, okay, inflammation of the nose. Chronic condition. Now Rhinitis Sicca, basically just remember these photos. Where does it happen? In people who are working in dry, hot, dusty surroundings like a baker, iron products manufacturing, anything to do with this kind of heated metal and all that, and then goldsmiths, okay. So basically where do you see this? In people who work in hot, dry, dusty surroundings, example bakers, iron and goldsmith. So what happens here, see their nose is exposed to this kind of heat, right, and dry environment, and it could be even dusty. So what happens here, the anterior 2/3 of the nose is affected. Just let me go back here, go forward here, anterior third of the nose. Anterior third of the nose is affected. Okay, anterior third of the nose. So nose, let us say 3 parts we make, anterior third of the nose, particularly the nasal septum is affected, okay. Now, how is it affected? Let's go back here to the definition. It is a crust forming disease seen in patients who work in hot, dry, dusty surroundings, okay. So crust forming disease, it is a crust forming disease, okay. It is a crust forming disease. Crust you have also seen in atrophic rhinitis, isn't it? So it is a crust forming disease. Basically here what is affected? The anterior third of the nose is affected, particularly the nasal septum. Okay, this condition is confined to the anterior third of the nose. This is what you will be able to differentiate, because in this only the anterior part of the nose is affected. But in atrophic rhinitis you saw the turbinates, nasal mucosa, everything is affected. So if you remember, in atrophic rhinitis, what and all were affected? The arteries, the nerves, the nasal mucosa, the turbinates, everything was affected. But in Rhinitis Sicca, what is affected? The anterior third of the nose is affected, and what is affected? Particularly the nasal septum. How's it going, people? What are we looking at today? Rhinitis Sicca. Okay, Sicca means what? Dry, yes. So, what happens here? They have explained the ciliated columnar epithelium undergoes squamous metaplasia with atrophy of the glands, seromucinous glands, same thing. So again here some kind of metaplasia. What metaplasia? Squamous metaplasia, everything is becoming squamous, right? So what is undergoing ciliated columnar epithelium is becoming squamous, isn't it? So let's draw again. So here you have ciliated columnar epithelium with all the cilia, right? This is how the epithelium is. So let's draw the nucleus again. So this ciliated columnar epithelium, now what is it becoming? It is converting itself into squamous epithelium. Squamous. It's becoming squamous. Right? So it's becoming squamous. Right? So this is happening in what, guys? In Rhinitis Sicca. Why? Because of exposure to dry, hot, dusty environment, okay. So columnar epithelium, ciliated columnar epithelium is undergoing squamous metaplasia, and also the glands, all the glands whatever are there, they are getting atrophied, and all this is happening only in the anterior third of the nose. Okay, let's continue. Crust form on the anterior part of septum. So again, anterior part of septum, what is forming? Crust, and when they try to remove it, there will be ulceration and epistaxis, and also it can lead to septal perforation. Let's just go forward, we'll understand. So basically what these people are doing, What are we looking at? Rhinitis Sicca. So these people will have crust formation where in the anterior anterior third of the nose. So what they will do, they will try to pluck it, nose picking. Then it will lead to epistaxis. It can also lead to the perforation of the nasal septum. Nasal septum itself can get perforated. So where is the nasal septum? So it can get perforated. So nasal septum can get perforated. Where? In Rhinitis Sicca. Why? Because of all this trauma. So let's just go back here and understand. Crust formed on the anterior part of septum. Yes, crust is formed on the anterior part of the septum. And when they are removed, their removal causes ulceration. Okay, this word we forgot. It also causes ulceration. Right? Ulceration, epistaxis, that is nosebleed, and it can also lead to septal perforation. Okay. So what are the problems these people will have? Bilateral nasal obstruction they can have, bilateral nasal obstruction they can have, and they can have epistaxis, right? Septal perforation. Septal perforation. Ulceration. Why do they have nasal obstruction? Due to crusts. Right? Okay. Why these crusts and all have happened? Because of exposure to hot, dry and dusty environment. Then there's squamous metaplasia. Okay. So let's continue, guys. So we have to move on to the treatment of Rhinitis Sicca. So Rhinitis Sicca, what is the treatment? Basically you have to correct their occupational surroundings. So you can see here, occupational surroundings have to be corrected. He's wearing all protective gear. And doctor can prescribe a bland ointment just as a protective layer, isn't it? Just a protective layer, and that will be what? A bland ointment. And this can have antibiotic and steroid also. Okay, they can add antibiotic and steroid also to the affected part. Then you should avoid nose pricking and forcible removal of crust. You should avoid. How how to remove the crust? Yes, nasal douche. So this is something like you have already seen in atrophic rhinitis. Let us look at that again. Basically to irrigate and remove these crusts. Let's just go back to atrophic rhinitis and look at that. So nasal irrigation and removal of crust. This is what we saw, right? So what will they do here? Alkaline douche. So they will give warm, normal saline or alkaline solution which is made up of sodium bicarbonate, sodium biborate, sodium chloride. Okay, these three they can give. Okay, there is a specific concentration of this. 1 part of soda bicarbonate, 1 part of sodium biborate and 2 parts of sodium chloride in 280 ml of water is used to irrigate the nasal cavity. The solution is run through one nostril and it comes out of the other nostril. It feels a little yuck, yeah. Okay, then what happens? It loosens the crust and removes thick tenacious discharge. So it loosens the crust and removes thick tenacious discharge. Care should be taken to avoid pushing the fluid into sinuses and eustachian tube. So you should just take care not to push the this fluid into sinuses or eustachian tube. Okay, so initially they will do this 2 to 3 times a day. Later on, every one alternate day or once in 3 days they can do this. Okay, so first they have to remove, they have to loosen these, right? And then they have to remove. If there are any hard crusts, they have to loosen those and mechanically then remove them with forceps or suction. Okay. So in atrophic rhinitis, what we exactly saw was they also had mentioned one thing like, let's go back to atrophic rhinitis treatment. There they mentioned 25% glucose and glycerine. So this is painting with the glucose and glycerine. Why? This will inhibit the growth of some organisms. Then local antibiotics and all they had mentioned in atrophic rhinitis. But in Rhinitis Sicca, what they are generally saying is nasal douche like the one used in atrophic rhinitis. They're talking only about the alkaline solution, isn't it? They're not talking about anything else. But here they have mentioned antibiotic and steroid. Okay. Steroid was not mentioned in atrophic rhinitis, isn't it? So let's just take a recap now what we have seen in this video. Rhinitis Sicca. Sicca means dry, dry, dry. That's why this photo, dry. Okay, why? Because the person is working in hot, dry, dusty environment. So Rhinitis Sicca is a type of chronic rhinitis, non-specific inflammation of the nose, which is a chronic condition. Other examples, if you want, you can note. Rhinitis Sicca is a crust-forming disease seen in patients who work in hot, dry, dusty surroundings. Example, bakers, ironsmith, goldsmith. Here the anterior third of nose is affected. Particularly what is affected? The nasal septum is affected. The ciliated columnar epithelium undergoes squamous metaplasia. Even atrophy of the glands are there. This you should not forget. Atrophy of glands. Okay. So metaplasia, don't forget that word. Squamous metaplasia. Then crusts are formed. Yes, crust is an important word. Then ulceration, epistaxis, septal perforation. Clinical features: bilateral nasal obstruction because of crust. Then nose picking can lead to ulceration, epistaxis, septal perforation. Then coming to treatment, correction of the occupational surroundings, bland ointment which can contain antibiotic steroid. Then avoid all pricking and forcible removal of crust. Nasal douche, like we told you, what and all you should give: 1 part sodium bicarbonate, 1 part sodium biborate and 2 parts of sodium chloride in 280 ml of water. Let's just, they can give saline or just add these details here so that you will be able to write in the exam. Alkaline solution is made by dissolving a teaspoon of powder containing soda bicarbonate 1 part, sodium biborate 1 part, sodium chloride 2 parts in 280 ml of water. So what are the three things? Soda bicarbonate, sodium biborate and sodium chloride in 280 ml of water. Okay. Is it clear, people? Then, don't forget to mention all these extra things, okay? They should do 3 times a day and then alternate day, once in 3 days, all that. Hard crust, they should not force remove and all, okay? Then what else? If nasal perforation is there, septal perforation, all that they can get treatment. Perforation, if it is there, they should get treatment. Okay. What else? That's all for now. See you in the next video, guys. Bye bye.